One of the biggest medication mistakes people make is taking iron tablets and omeprazole together. As a nurse, it's very important you understand this, because a patient can take iron tablets every single day and still remain iron deficient. And here's why. Omeprazole is a proton pump inhibitor. It reduces stomach acid, but iron needs an acidic environment to be properly absorbed. So when they are taken together, the stomach acid decreases and iron absorption drops significantly. That means the patient may not respond properly to treatment for anemia. So instead of the hemoglobin improving, the patient may still feel tired, weak, dizzy, and short of breath. This is especially important in patients with iron deficiency anemia, pregnancy, and chronic blood loss. So how should we give them then? We separate the doses. Give iron at least 2 hours apart from omeprazole, and preferably on an empty stomach, or with vitamin C for better absorption. Orange juice or vitamin C helps improve iron absorption. In summary, omeprazole lowers stomach acid, and low stomach acid reduces iron absorption. So sometimes the problem is not the medication itself. It's how the medications are taken together. One of the biggest mistakes people make after a snake bite is rushing to give antivenom. As a nurse, you should know that not every snakebite needs antivenom, and giving antivenom at the wrong time can sometimes do more harm than good. Here's why. First, not all snakes are venomous, and even venomous snakes do not always inject venom. This is called a dry bite. The snake bites but releases little or no venom. So if there are no serious symptoms, the patient may only need monitoring and supportive care. Now here's the important part. Antivenom is not a harmless medication. It can cause severe allergic reactions, anaphylaxis, fever, and hypotension. So we don't just rush and give antivenom immediately. So when should we give antivenom? Good question. We give antivenom when there are clear signs of significant envenomation, like rapid swelling, respiratory distress, paralysis, or coagulopathy.
So what should we do first when a patient arrives with a snake bite?
You do not rush to hang antivenom immediately. First, you assess the patient properly. You monitor vital signs, swelling progression, breathing, neurological symptoms, and bleeding or clotting problems. You also keep the patient calm because movement can worsen it. Immobilize the affected limb, start IV access, and monitor closely. Because some patients may only need observation, pain control, fluids, and wound care. Snakebite does not automatically mean antivenom. Sometimes good nursing care is knowing when not to rush a medication. Don't ever make this mistake. As a nurse, be careful how you say, "You'll be fine" to a patient. I know it sounds harmless, kind, reassuring, comforting. But as a nurse, that's something you need to be very careful about saying. Let me explain why. First, you don't actually know the patient will be fine. Medicine is unpredictable. A patient can look stable one minute and things can change the next. So when you say you'll be fine, you're making a promise you cannot guarantee. Second, it can break trust. If something goes wrong, that patient or their family will remember exactly what you said. They'll say, "But you told us everything would be fine." Third, it can feel dismissive, even if you don't mean it that way. Patients are scared, they're anxious, they have real concerns. And instead of addressing that, we shut it down with, "You'll be fine." And fourth, it takes away an opportunity to educate and connect. So instead of saying "you'll be fine," what should we say? You can say, "I understand why you're worried. Let me explain what's going on. We're monitoring you closely. I'm here to help. You're in the right place." These responses build trust, understanding, and confidence. Because patients don't need false reassurance. They need honesty, presence, and clear communication. Sometimes, "I'm here with you" is more powerful than "you'll be fine."